NEET PG free test calendar is there for March month, week 4. You can use code Shital10 to unlock free live class. NEET PG 2022 All India mock test is there on 27th of March 2022 at 9 a.m. You can use the code Shital10 to enroll for the test. Previous year question bank is going to get launched on 23rd of March 2022. Launching MBBS Professor 1, your path towards cracking MBBS and next. So stay tuned with Unacademy. Doubt clarification series is there. Let us go through plus subscription details. With plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice, and you can even have access to the question bank having more than 25,000 questions in it. With iconic subscription, you can have access to the best from two of the best, Unacademy and Prep Ladder. With the Unacademy, you will find various resources like well-structured live batches, recorded classes, question bank, and many more. With Unacademy and Prep Ladder, with the Prep Ladder, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. These all are toppers of FMG 2021. Congratulations to all the toppers from Unacademy. Now Unacademy came up with some special class feature. Now the classes will be highly interactive. There will be a poll for the learners for their better understanding. You can raise a hand and interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available. You can download it. And you can even have access to the recorded sessions. You can attend the classes from any time, anywhere. Various batches are there. NEET PG 2022 high-year theory revision batch. Duration is 1.5 months. NEET FMG 2022 high-year revision and MCQ batch. Duration is 2 months. NEET PG subscription plus iconic and light subscription are available with various duration and different prices. You can choose according to your requirement. As I told you, launching of a previous year question bank is there, so stay tuned with Unacademy. Launching auto daily practice papers. So quick practice test will be there after every plus class to assess your knowledge about the concept. And launching MBBS Professor 1. So now come to today's topic of a respiratory system, that is mechanism of breathing. Mechanism of breathing. Okay, respiration. You know there are two phases of respiration. Two phases are there. One is inspiration, another one is expiration phase, right? Inspiration phase and expiration phase. Inspiration is an active process and expiration is passive process. Inspiration is active process and expiration is a passive process. Now let us understand the inspiration first. Inspiration, during inspiration, what happened when you inhale air? Okay, at that time what will happen? Because of the nervous discharge from brain, there will be increase in the size of thoracic cavity. Okay, increase in the size of thoracic cavity. Now increase in the size of thoracic cavity will cause increase in the size of thoracic cavity will cause movement of the pleura. It will cause movement of pleura. Parietal pleura will follow the expanding chest wall. Parietal pleura will follow the expanding chest wall, and visceral pleura will follow the parietal pleura. Expanding chest wall, okay, there is expanding chest wall. Parietal pleura will follow the expanding chest wall. Visceral pleura will also follow the parietal pleura, and thus elastic lungs parenchyma lungs also follow the thoracic cavity movement passively. So when there is movement of the lungs, it will cause expansion, right? Expansion of the lungs will occur. So what happens here? Expansion of the lungs will cause decrease in the pressure, decrease in the pressure in the lung parenchyma. Okay, there will be decrease in the pressure in the lung parenchyma. There will be decrease in the pressure in lung parenchyma. So what it will cause? It will cause movement of the atmospheric air. Movement of the atmospheric air drawn into the lungs. Okay, the reason behind that is decrease in the pressure inside the lungs. Okay, so because the negative pressure is there, right, so it will cause movement of the atmospheric air inside the lungs. So this is active process. Now second one is expiration, that is a passive process. So what happened here? At the end of inspiration, at the end of inspiration, muscles of the inspiration which were contracted, now simply they are relaxing. So when the muscle starts relaxing during at the end of inspiration, relaxation will cause the elastic recoil of the thoracic wall and lungs to cause passive expiration. Okay, so expiration is a passive process. Now let us understand the first phase in detail. Muscles of inspiration, muscles of tidal inspiration. Tidal means normal, regular, at rest. Okay, so muscles of tidal inspiration are external intercostal muscle and another one is diaphragm. Now what is diaphragm? Diaphragm consists of the muscle fibers which converge on dome shape, dome-shaped central tendinous portion. Okay, muscle fibers will arises from xephisternum, lumbar vertebrae, inner surface of the lower 6 ribs. Okay, and it is supplied by C4, 5 and 6. So diaphragm and external intercostal muscles are the muscles of tidal inspiration. Whenever there is a forceful inspiration, in case of forceful inspiration, the additional muscles will be involved. Additional involvement of the muscles of the inspiration will occur. Now let us understand the act of inspiration. See this one. When the when thoracic wall expands, okay, at that time what will happen? Second to sixth rib will move upward. Okay, second to sixth rib will move in the upward direction and lower ribs will move outwards and upwards. Okay, it will move outwards and upwards. See, second to sixth rib will move upward. Okay, so it will cause increase in the antero-posterior diameter. Okay, it will increase the antero-posterior diameter, and this movement, this is important, this movement is known as pump handle movement. Pump handle movement. Okay, this is during the phase of inspiration. Okay, and for the upper ribs. Okay, and the lower ribs will move outward and upward. So it will cause increase in the transverse diameter. It will cause increase in transverse diameter. This is bucket handle movement. Okay, this is bucket handle movement. So if you see the image, okay, see this is how the pump handle movement will occur. Okay, to second rib to sixth rib will move upward. So like moving the pump, okay, moving the handle of the pump. So this is called as the pump handle movement. And another one is this one. Okay, when the lower ribs will move, okay, it will move upward and outward. Okay, it will move upward and outward. So this is like moving the handle of the bucket. So this is called as a bucket handle movement. By bucket handle movement, it is causing increase in the transverse diameter. By pump handle movement, it causes increase in the antero-posterior diameter. Okay, so this is important. Now, the next part. So, during inspiration, by this both, okay, by both of this, it will cause increase in the antero-posterior diameter and it will cause increase in the transverse diameter of the chest. So, with 1 centimeter descent, with 1 centimeter descent of the diaphragm, it will cause movement of the air. Approximately 200 to 300 ml of the air will get sucked in. Okay, 200 to 300 ml will get air, atmospheric air will get sucked in with 1 centimeter descent of the diaphragm. So you can say here that diaphragmatic movement and external intercostal muscles, they are the muscles of inspiration. Simply, if only diaphragm moves, in that case also 75% of the tidal volume, okay, will that much of amount of air will get sucked in. Okay, so diaphragmatic movement accounts for 75% of the tidal volume. Okay, so what is the clinical significance of this? We are constantly speaking, I am constantly speaking about diaphragm and external intercostal muscles. Okay, so see, both are the muscles of inspiration. Any of this, either diaphragm or external intercostal muscle, they alone can maintain adequate ventilation at rest. Okay, it means that if there is a diaphragmatic paralysis, then also adequate ventilation can be maintained by simply moving external intercostal muscles. By contraction of the external intercostal muscles, it, though it will be little bit having, it will need simply more effort, उसको effort ज़्यादा चाहिए, but it will cause in adequate ventilation. Adequate ventilation जो है वो maintain होगा simply by movement of the external intercostal muscles. Okay, so in patients with bilateral phrenic nerve paralysis, this is important, bilateral phrenic nerve palsy, or you can say paralysis. Okay, in that case there will be paralysis of the diaphragm, right? So diaphragmatic movement will be affected, but external intercostal muscles movements are intact. Okay, intact innervation of external intercostal muscles. So what will happen? Respiration, though it will be little bit more effort, it will need some more effort, but adequate ventilation can be maintained to maintain the life. Okay, so bilateral phrenic nerve palsy or paralysis, which causes diaphragm paralysis, but if external intercostal muscle innervation is intact, then tidal respiration can be maintained. Okay, though more force will be needed, but adequate ventilation can be maintained to maintain the life. If there is a transaction, if there is a transaction of the spinal cord, if there is a transaction of the spinal cord above third cervical segment, above third cervical segment, then it is fatal. Okay, the reason is C4, 5, 6. Okay, C4, 5, 6 muscle, diaphragmatic paralysis will be there. Okay, but if there is a transaction below fifth cervical segment, okay, in that case phrenic nerve will be left, okay, which innervates the diaphragm, so it will be intact, diaphragmatic movements will be intact, so it will not be fatal condition, वो fatal condition नहीं है. Okay, now come to the position of the diaphragm with the posture. Which of the position is most comfortable and which one is least comfortable? See, whenever the person sit in sitting position, what will happen? This is the most comfortable position, sitting position. Why? That is because diaphragm is down. When you sit, diaphragm is down because of the gravity. Okay, and it is not even pressing the abdominal content, so it is not even causing increase in the intra-abdominal pressure. So sitting position is the most comfortable position. What happens during standing? In the standing position, abdominal muscle will contract. Okay, so it will cause increase in the intra-abdominal pressure, so it will little push the diaphragm upward. Okay, little ascent of the diaphragm will be there. So as compared to sitting position, standing position is not comfortable. Then least comfortable position is supine. Okay, the reason behind that is because of the supine position, diaphragm moves upward, abdominal content will push the diaphragm upward. Okay, so supine position is least comfortable position. Okay, it is least comfortable position. Most comfortable position is sitting position. Now come to the we discussed about tidal inspiration. Now come to forced inspiration. What happens during forced inspiration? See, when forced inspiration means you are trying to have more amount of air with each act of inspiration, right? So there will be forceful contraction of the diaphragm. That is the first thing. Okay, even if you can imagine by yourself, simply when you try to breathe in forcefully, okay, at that time what will happen? There will be forceful contraction of the diaphragm. Second thing, another muscle of inspiration is external intercostal muscle. So there will be forceful contraction of external intercostal muscle also. Then there are accessory muscles. Now it is needed, right? So accessory muscles of inspiration will also contract. So here sternocleidomastoid muscle, serratus anterior, scalenus muscle, and intrinsic muscles of larynx. All these are accessory muscles of inspiration. Sternocleidomastoid muscle, serratus anterior, scalenus. Okay, and intrinsic muscles of larynx. So what it will do? Sternocleidomastoid muscle, it will lift the sternum upward. Serratus anterior will lift the ribs upward. Okay, scalenus muscle will lift first two ribs. And intrinsic muscles of larynx, okay, abductors. During inspiration, what we need is abductor muscles of the vocal cord. They will contract during early phase of inspiration. So it will pull the vocal cords apart and opening of the glottis will occur. There will be opening of the glottis, and it is supplied by, this is very, very important, recurrent laryngeal nerve. Okay, it is supplied by recurrent laryngeal nerve, which is a branch of, vagus nerve, right? So when there is a paralysis of recurrent laryngeal nerve, will cause paralysis of the inspiratory muscles, okay, these intrinsic muscles of larynx. So it will cause inspiratory stridor. Okay, this is very, very important. It will cause inspiratory stridor. Inspiratory stridor means inspiration with loud sound. Okay, Paralysis of the recurrent laryngeal nerve will cause inspiratory stridor. That is because of paralysis of the intrinsic muscles of larynx. Okay. Abductors of the muscles of the vocal cord, abductor muscles of the vocal cord will get paralyzed. Okay. If there is a damage to the recurrent laryngeal nerve. So it will cause inspiration with loud sound. That is called as a inspiratory stridor. Now come to the another phase, that is expiration. Inspiration phase is over. Now expiration. As I told you, expiration is a passive process, right? Expiration is a passive process. Simply muscles of inspiration which were contracted, now they are relaxing. Simple, because of the relaxation of the muscles of inspiration, it will cause movement of the air out of the lung. Out of the lungs. Okay, so act of expiration will occur. Whenever expiration is forceful, okay, at that time accessory muscles of expiration need to work. Okay, it means that anterior abdominal muscles, anterior abdominal muscles and internal internal intercostal muscle. Okay, both these muscles are accessory muscles of expiration. Expiration itself is a passive process, doesn't need anything. Simply which were contracted, now it is relaxing. So when the muscle starts relaxing, it will cause increase in the pressure inside the lungs. Okay, so it will cause movement of the air out of the lungs. Okay, if expiration can be effortful, when the expiration is effortful, at that time accessory muscles of expiration are needed. So they are anterior abdominal muscle and internal intercostal muscles. Okay, so in case of forceful expiration, what we need, usually expiration is a passive process, so we don't need anything, right? If there is a forced expiration, in that case we need contraction of abdominal muscles. So when there is a contraction of abdominal muscles, what it will cause? It will cause increase in the intra abdominal pressure. Increase in the abdominal will contract, so it will cause increase in the intra abdominal pressure and it will push the diaphragm upward. Increase in the intra-abdominal pressure will cause pushing of the diaphragm in the upward direction. Then contraction of the internal intercostal muscles. Contraction of the internal intercostal muscles will cause, it will pull the ribs downward. Okay, pull the ribs downward. So when the ribs are pulled downward, it will cause decrease in the AP diameter. It will cause decrease in the antero-posterior diameter and transverse diameter of the chest. So again, it is causing more pressure inside the lungs, right? Same in that. Then later on, accessory muscles of expiration will go. Okay, that is adductor. See, adductor. In inspiration, it is abductor. In expiration, it is adductors of vocal cords. Okay, so what they will do, they begin to contract in the early phase, early in the inspiration, but their contraction is not much complete. It is not much complete. Okay, so you can say that it seems like they maintain the respiratory function. They can maintain the respiratory function in a protective way. Okay, like they prevent the movement of the food or fluid in the respiratory passage. Okay, it will not allow food or fluid to enter in the trachea. Okay, so when these adductor muscles, if they are paralyzed, in that case food or fluid can enter into the trachea and it causes aspiration, right? So it can cause aspiration pneumonitis. This is very, very important. It can cause aspiration, pneumonia, or you can say edema, pulmonary edema. Okay, when it will occur? When the adductors of vocal cord, okay, at the beginning of the expiration only it will start getting contracted, right? So if these adductors of the vocal cord if they are paralyzed, then it is having a protective function. So if they are paralyzed, in that case what will happen? Food or fluid, whatever you are consuming, it will have a higher possibility to enter into the trachea. So it causes aspiration pneumonia or edema. Okay. So this is all about the different phases of respiration. Now come to the rate. Okay, respiratory rate. How much is the normal respiratory rate? In adult, it is 12 to 14 per minute. When we say respiratory rate, means we are counting the entire cycle of respiration, act of inspiration and expiration together one. Okay, so respiratory cycle, how many respiratory cycles are there in 1 minute? It is normally 12 to 14 per minute. With each act of tidal respiration, tidal volume means amount of air, atmospheric air entering in the lungs is approximately 500 ml. It ranges from 350 to 500 ml. Approximately you can say 500 ml. This is tidal volume. Tidal volume means the volume which enters in the lungs with each act of tidal respiration, right? So that is tidal volume. You can count pulmonary ventilation from this. Okay, if you know tidal volume and respiratory rate, normal pulmonary ventilation is approximately 6 to 7 liters per minute. Okay, normal pulmonary ventilation is 6 to 7 liters per minute. Respiration, when we say this is like 12 to 14 per minute, this is termed as eupnea. Okay, means normal quiet respiration. Okay, whenever respiratory rate increase in the respiratory rate is termed as tachypnea. Understand the word carefully. Tachy means more. Pnea stands for respiration. So tachypnea means increase in the respiratory rate. Whenever respiratory rate reduces, decrease in the respiratory rate is termed as bradypnea. Brady stands for less, pnea means respiration. So decrease in the respiratory rate is termed as bradypnea. Okay, so this is all about mechanism of breathing. Okay, here applied aspects are very important. I would like to emphasize on that. So from MCQ point of view, what you are supposed to remember is, see, external in tidal respiration, both will play a role, diaphragm and external intercostal muscles. Diaphragm plays a major role and it is responsible for 75% of the tidal volume. Okay, during quiet breathing, 75% of the tidal volume will enter just simply by the movement of the diaphragm. Okay, pump handle movement is there. This is responsible for increase in the anteroposterior diameter, and bucket handle movement is responsible for the increase in the transverse diameter. Then clinical significance, that always remember कि अगर डायफ्राम पैरालिसिस है पर अगर एक्सटर्नल इंटरकोस्टल मसल्स जो है उसका इनर्वेशन अगर इंटेक्ट है, in that case दो breathing will be little, उसमें एनर्जी ज्यादा चाहिए and it will need more force, but it will be normal, right? कि adequate ventilation हो सकता है to maintain the life. Okay, phrenic nerve paralysis C456. Okay, तो अगर spinal cord का if there is a transaction of the spinal cord below the level of fifth segment, okay, in that case it is not a fatal condition. Okay, then diaphragm position and posture relationship, sitting position is most comfortable. Then intrinsic muscles of the larynx, when adductors muscles of the vocal cords are paralyzed, it can cause abductor muscles of the vocal cord, which is responsible for the forced inspiration. So when the recurrent laryngeal nerve paralysis, it will cause inspiratory stridor. Okay, loud inspiration with the loud sound. Okay, paralysis of the recurrent laryngeal nerve will cause this. Okay, inspiratory stridor. Then expiration, when adductors of the vocal cords are paralyzed, in that case it will cause aspiration pneumonitis. Okay, because it is having a protective role. So if it is paralyzed, in that case it will cause aspiration of the food, or you can say entry of the food or fluid in the trachea. So it can cause aspiration pneumonia or edema in the individual. So this is all about today's class, mechanism of breathing. Thank you so much. Stay tuned for study. Thank you so much. Subscribe on Academy Future Doctors channel and help us to reach to more and more number of students. Thank you.